The break room fell silent the moment Rebecca Walsh walked in, and then the laughter started. It always started the same way, a snicker from Dr. Garrison, a whispered comment from one of the younger nurses, and then the collective amusement of people who had decided she was beneath them. Rebecca kept her eyes on the coffee maker, her hands steady as she poured, even though something inside her chest was crumbling like old concrete. Still wearing those same scrubs from 2015, Becca. Someone called out. She didn't turn to see who. It didn't matter anymore. Maybe if she spent less time in the free clinic and more time networking, she'd actually get somewhere, another voice added, and the laughter grew. Rebecca took her coffee and walked out without a word. She had learned, over the past 3 years at Mercy General Hospital, that defending yourself only gave them more ammunition. Silence was armor, even if it felt like slowly suffocating. Her shift started the way most did, a blur of vitals, medication rounds, and the particular kind of exhaustion that came from being invisible. At 41, Rebecca had spent 2 decades in nursing, and somehow she had ended up here, at the bottom of a hierarchy that valued pedigree over experience, connections over compassion. The other nurses had come from prestigious programs, had letters of recommendation from department heads, had families who played golf with hospital board members. Rebecca had come from a state school nobody had heard of, had worked her way through night classes while raising her daughter alone, and had no one to vouch for her except the patients whose names nobody remembered. The free clinic she volunteered at twice a week was in the worst part of the city, where gunshot wounds were common and insurance was a fantasy. The staff at Mercy General thought it was beneath her, or rather, exactly where someone like her belonged. They didn't understand why anyone would choose to spend their off hours in a place that couldn't even pay them. Rebecca understood, though. She understood because she had been on the other side once, 17 years ago, when her daughter Emma had spiked a fever of 105 and Rebecca had no insurance, no money, and no options except a free clinic that saved her baby's life. The nurse who had stayed past her shift, who had held Emma while Rebecca sobbed in the bathroom, who had paid for the antibiotics out of her own pocket, that nurse had never told Rebecca her name. But Rebecca remembered her hands, gentle and certain, and the way she had said, "You're going to be okay, Mama. Both of you." So Rebecca went back. Every Tuesday and Thursday evening, she worked at St. Mary's Free Clinic, and she held the hands of mothers who were terrified, and she paid for medications when she could, and she never asked for anything in return. "You're a fool, Drive," Garrison had told her once. "You could be building relationships here, making connections that matter. Instead you're wasting your time on people who'll never be able to do anything for you." Rebecca had just nodded. There was no point explaining that not everything was a transaction. The mockery had started small. Comments about her outdated scrubs, jokes about her lack of ambition, the way she was always passed over for promotions despite her experience. But over the past 6 months, it had intensified. A new director of nursing had been hired, a woman named Carolyn Pierce who had made it clear from day one that she valued image over substance. Carolyn wore designer labels and threw fundraising galas and spoke about elevating the profession. She looked at Rebecca like she was a stain on the floor. "You need to understand," Carolyn had said during Rebecca's last performance review, "that representation matters. The nurses who represent this hospital need to embody excellence. They need to be polished, professional, connected. You're adequate, but adequate isn't enough anymore." Rebecca had walked out of that meeting with her hands shaking and had cried in her car for 20 minutes. That night, Emma had found her staring at her laptop, looking at job postings. "Mom, you love nursing," Emma had said. She was 19 now, in college on a partial scholarship, working 2 jobs to cover the rest. "Don't let them take that from you." "I'm tired, baby," Rebecca had whispered. "I'm so tired of being treated like I don't matter." Emma had wrapped her arms around her mother, and Rebecca had let herself be held, and neither of them had said what they were both thinking, that maybe being tired was just the price of surviving. The call came in at 2:47 p.m. on a Tuesday in late October. "Mass casualty incident," the dispatcher said. "Training exercise gone wrong at the naval base 40 miles north. Multiple critical injuries incoming." The erupted into controlled chaos, and Rebecca felt the familiar shift in her body, the way everything non-essential fell away and left only the mission: save lives. The first ambulance arrived within 20 minutes. Rebecca was assigned to bed 3, and when the paramedics wheeled the patient in, her breath caught. The man was massive, even lying down, easily 6'3", 240 pounds of solid muscle. His face was a mess of blood and burns, his right leg twisted at an unnatural angle, his breathing labored and wet-sounding. But it was his eyes that stopped her. Even through the pain, even half-conscious, there was something in those eyes that she recognized. Focus, determination, the absolute refusal to quit. Compound fracture of the femur, possible internal bleeding, second-degree burns across the upper torso, suspected punctured lung, the paramedic rattled off. Vitals are holding but unstable. Patient is, I've got him, Rebecca said, and her hands were already moving. Doctor. Garrison appeared at her shoulder. I'll take this one, Walsh. You handle the minor injuries. Rebecca looked at the monitor, at the patient's dropping oxygen saturation, at the subtle signs of shock setting in. He needs immediate intervention. I can stabilize him. I said I've got it. Garrison's voice was sharp. Go make yourself useful elsewhere. Rebecca stepped back because she had learned to step back, and she watched Garrison fumble with the IV line, watched him miss the vein twice, watched precious seconds tick away. The patient's eyes found hers, and there was a question in them, a confusion that cut through his pain. Why was he being treated by someone who didn't know what they were doing? She couldn't stand it anymore. Doctor. Garrison, with respect, you need to. Nurse Walsh, if you can't follow simple instructions, you can leave my ER. The patient's oxygen saturation dropped to 87%. Rebecca made a decision. No, she said. Garrison turned to stare at her. Excuse me, I said no. This patient is crashing, and you're wasting time. Step aside or I'm going over your head right now. The had gone quiet. Everyone was watching. Garrison's face turned purple with rage, but Rebecca was already moving, already taking over. Her hands found the vein on the first try. She got the line in, started fluids, administered pain medication with the exact dosage needed for a man his size. She assessed the burns, noting the depth and coverage, calculating fluid replacement needs. She stabilized the fractured leg with a temporary splint that would hold until surgery. She listened to his lung sounds and immediately called for a chest tube kit. Tension pneumothorax, she said. If we don't decompress now, he'll code within minutes. You can't make that call, Garrison hissed. You're not qualified to. Then override me, Rebecca said, not looking up. But do it fast, because he's dying. Garrison didn't override her. Rebecca performed the needle decompression with hands that had done this procedure a dozen times in the free clinic, where resources were scarce and decisions had to be made without waiting for approval. The patient's oxygen saturation began to climb. His breathing eased. The monitors stopped screaming. She worked for 47 minutes straight, stabilizing him, managing his pain, coordinating with the surgical team, monitoring for complications. When they finally wheeled him up to the OR, Rebecca's scrubs were soaked with sweat and blood, and her hands were shaking with adrenaline crash. Garrison grabbed her arm. My office. Now. The walk to his office felt like a funeral march. Rebecca knew what was coming. Insubordination, overstepping her scope of practice. Possible suspension, maybe termination. She had broken every rule, had challenged a physician in front of the entire staff, and it didn't matter that she had saved a life. What mattered was the hierarchy, and she had shattered it. But before they reached the office, Carolyn Pierce appeared, her face tight with fury. Nurse Walsh, with me, immediately. Rebecca followed her to the administrative wing, her heart hammering. They passed Drive. Garrison, who looked smug, triumphant. This was it. This was the end. Carolyn's office was pristine, all glass and chrome and awards on the walls. She gestured for Rebecca to sit, then closed the door with a decisive click. Do you have any idea what you've done? Carolyn's voice was ice. I saved a patient's life, Rebecca said quietly. You humiliated a senior physician. You performed procedures outside your scope of practice. You undermined the entire chain of command in my ER. The patient was dying. That's not the point. Carolyn slammed her hand on the desk. The point is that you don't get to make those decisions. You're a nurse. You follow orders. That's how this works. Rebecca looked at her hands, at the blood still staining her cuticles. She thought about Emma, about the bills that were piling up, about the fact that she couldn't afford to lose this job. But she also thought about the man in bed 3, about his eyes, about the way his breathing had eased when she had done what needed to be done. Then fire me, she said. But I won't apologize for it. Carolyn stared at her. You're unbelievable. You know that. You're so self-righteous, so convinced you're some kind of hero. But you're just a mediocre nurse with delusions of grandeur. The knock on the door cut her off. Carolyn's assistant peeked in, looking nervous. I'm sorry to interrupt, but there are some people here who need to speak with Ms. Walsh. They're very insistent. Tell them she's unavailable, Carolyn snapped. They're from the Navy, the assistant said quietly. And they're not leaving. Carolyn's expression shifted from anger to confusion. She nodded curtly, and the door opened wider. 3 men in Navy uniforms walked in, and the energy in the room changed immediately. These were not men who asked permission. The one in front was older, maybe 55, with silver hair and a chest full of medals. His bearing radiated authority. Ms. Rebecca Walsh, he said. Rebecca stood. Yes, sir. I'm Captain Richard Holt. This is Lieutenant Commander Stevens and Senior Chief Martinez. We're here about the patient you treated in the ER today. Rebecca's mouth went dry. Is he okay? He's in surgery now. Prognosis is good, thanks to you. Captain Holt's eyes were sharp, assessing. Do you know who he is? No, sir. I didn't ask for identification. I just knew he needed help. His name is Commander James Reeves. He's the commanding officer of SEAL Team 7, one of the most decorated special operations officers in the Navy. Holt paused, and something flickered in his expression. He's also my son-in-law. The room went very still. The paramedics briefed us on his condition when he arrived, Holt continued. They said he was critical but stable. But according to the surgical team, he would have died if someone hadn't performed an emergency needle decompression in the ER. They said that whoever did it bought him the time he needed, and did it with the kind of precision you'd expect from a combat medic, not a civilian nurse. He turned to look at Carolyn, then back at Rebecca. The staff told me it was you. They also told me you did it against direct orders from the attending physician. They seemed to think you should be disciplined for it. Rebecca felt the world tilt. This was worse than she thought. Now she wasn't just fighting the hospital politics. She was caught in the middle of something much bigger. Sir, I did what I thought was necessary to save your son-in-law's life, she said. If that was wrong, then I accept the consequences. Holt studied her for a long moment. Then he did something unexpected. He smiled. Wrong, Ms. Walsh. You saved the life of one of the finest officers I've ever known. You saw what needed to be done, and you did it, even when it meant putting yourself on the line. That's not wrong. That's exactly what we train our people to do. He turned to Carolyn. I assume you're the administrator who was about to terminate Ms. Walsh for her actions. Carolyn's face had gone pale. We were discussing the incident. There are protocols that must be followed, procedures that would have killed my son-in-law, Holt said quietly, and there was steel in his voice now. I've spent 30 years in the Navy. I know something about leadership, about making hard calls under pressure, about trusting the people who have the skills and experience to get the job done. What I saw today wasn't insubordination. It was excellence. He looked at Rebecca again. The surgical team asked me to find you. They said they've never seen better pre-op stabilization on a trauma case this severe. They wanted to know where you trained. Rebecca swallowed hard. State University Nursing Program, sir. In the School of Hard Knocks. You ever work in combat medicine? No, sir. Just places where resources were limited and you learned to do more with less. Holt nodded slowly. The free clinic. I did my homework on you while James was in surgery. Street. Mary's free clinic, twice a week, for the past 10 years. Volunteering your time, your expertise. The director there said you're the best trauma nurse they've ever had. Said you've saved more lives than they can count. Rebecca felt tears prickling at her eyes. She blinked them back. Ms. Walsh, Holt said, and his voice was gentler now, my daughter is upstairs right now, waiting to find out if her husband is going to make it. They have 2 children, ages 4 and 6. Because of you, I'm going to be able to tell her that he's going to come home. Because of you, those kids are going to have their father. Do you understand what that means? Rebecca couldn't speak. She just nodded. Holt reached into his pocket and pulled out a card. I don't know what your situation is here, and frankly, I don't care. If this hospital doesn't appreciate what you bring to the table, I know people who will. The Naval Medical Center is always looking for experienced trauma nurses. The pay is better, the respect is guaranteed, and we don't tolerate people who put ego over patient care. He handed her the card. Think about it, and Ms. Walsh, thank you. From the bottom of my heart, thank you. The 3 officers left. The silence in Carolyn's office was deafening. Rebecca looked at her boss, at the woman who had spent 6 months making her feel worthless, and felt something shift inside her chest. Not anger, not triumph, Just a quiet, bone-deep exhaustion. I'll submit my resignation, she said softly. Effective immediately. Wait. Carolyn's voice cracked. She sat down slowly, and for the first time, she looked uncertain. Just wait, please. Rebecca waited. I was wrong, Carolyn said, and the words sounded like they were being dragged out of her. About you. About what matters. I spent so much time worrying about image, about how things looked, that I forgot why we're here. I forgot that it's not about the polish or the connections. It's about this. What you did today. That's what nursing is supposed to be. She looked up at Rebecca, and there were tears in her eyes. I have a cousin. He's a Marine. He deployed to Afghanistan 3 times, and the last time, he didn't come back the same. PTSD, traumatic brain injury. He's been in and out of VA hospitals for years, and the nurses there, some of them are like you. They don't give up. They don't treat him like a number. They see him, really see him, and they fight for him. My aunt says those nurses are the only reason he's still alive. Carolyn's voice broke. When Captain Holt was talking about you, about what you did, I heard my aunt's voice. Talking about the nurses who saved my cousin. And I realized I've been so busy trying to make this hospital look good that I forgot what good actually means. Rebecca sat back down. She didn't know what to say. Please don't resign, Carolyn said. Stay. Let me make this right. Let me fix what I've broken here. It's not just you, Rebecca said quietly. It's the whole culture. It's drive, garrison and the cliques, and the way experience doesn't matter if you don't have the right background. I can't keep fighting that battle every single day. I'm too tired. Then let me fight it with you. Carolyn wiped her eyes. I can't promise it'll change overnight. But I can promise you won't fight alone anymore. And I can promise that what you did today, that's what we're going to celebrate here. That's what we're going to build on. Rebecca thought about the Naval Medical Center, about starting over somewhere new. She thought about Emma, about stability, about the chance to work somewhere she might actually be valued. But she also thought about Street Mary's free clinic, about the mothers who came in terrified and left with hope. She thought about the patients at Mercy General who didn't have advocates, who needed someone who would fight for them even when it was hard. I need to see him, she said. Commander Reeves. I need to know he's okay. Carolyn nodded. I'll take you there myself. They went upstairs to the surgical ICU. Commander Reeves was out of surgery, intubated and sedated, but his vitals were strong.